in the Netherlands. Just a small introduction about myself. I graduated in 2020 at Masaryk University in Brno. Since then, I did my Dutch language level B2 plus certificate. And next week, we're opening our own practice. It's called Dental Clinics in Boys Enschede. And I'm a senior dentist. And the main treatments I do is basically Invisalign Go, aesthetics, and general treatments. And at the moment, I'm busy in 3 practices working there with a full-time schedule of 5 days from 8 to 5 o'clock. Dental Clinics is part of a company called Top Monster, which is part of the European Dental Group, which is the biggest dental group in Europe. They are specialized in different branches like Top Ortho, which is orthodontics, Brooklyn, which is for aesthetics, and maxillofacial surgery. I'm working for Dental Clinics, which is purely dentistry. Here you can see a map of the Netherlands with all the dental clinics that are currently there. It's more than 100. I'm working in Enschede. It's very far in the east, close to the German border. And yeah, so I will start with the benefits of working in the Netherlands, which is basically there's a shortage of dentists, which means there is a high demand, which gives you a freedom of choice. Because if people are needed, you can just choose wherever you want to be with very good conditions. You have a lot of international colleagues, meaning Spanish, Portuguese, and the Netherlands are very open to foreigners that want to work here. It's a relatively easy language because if you learn Czech, then Dutch will be no problem for you. I can assure you that. It's a Western European wealthy country, so it means the materials, the practices, the people's attitude is basically also different than, let's say, Eastern Europe or other countries. So you will also notice that. We have a very high density of people. There's around 70 million people in the Netherlands, so you can be sure there's more than enough work. And you have very easy chances to specialize and develop because they're not that strict with that you have to specialize in a university degree of 5-6 years. You can basically do it with some weekend courses, or you can just do it by yourself. And generally, I have to say the patients are very friendly, cultural, and open people. The benefits of working for dental clinics are that you have more than 100 practices, what I just told. So you have a uniform working policy all over the whole country. So you have in every dental clinic, so it should be the same style of working and the same guidelines that you can follow. We have specialists in house, meaning that you have a endodontologist and periodontologist you have in house, so you can basically just communicate with them and consult with them. And dental clinics always stands open for new patients, so there's never a patient stop because there's so many branches. Just about the main features of dental clinics, those 4, but I'm not going to go into further detail with those. So basically the most important now is how, if you're seriously interested, how will you apply and what are the requirements? By the way, it's also the same for doctors. So the process is basically the same for dentists and doctors. So the first thing you have to do is get this BSN, it's called. It's the Burger Service Number. So it's basically just an identity. And the 3 things you need for that is a passport, address to register as your home address, and a birth certificate. Without this number, you can basically don't do anything in this country. After that, it's required in the Netherlands to learn the language on a niveau of B2 plus. And you have to do an exam at the Babel Language School in Utrecht. So if you're further interested in this, I can also give you some information how this will be done and how it can be managed and where you can take classes. Then what you need to be registered at the Dental Chamber of the Netherlands, and it's called the BIG registration. And I took the actual transcript of what is required, and it's basically what you need for every dental chamber, to be honest. It's just like a CV, your identity, your diploma supplement. Then you also need what I just said, the B2 plus certificate, and that you're not followed by police, and that you're not registered in other countries where you're working at the current time. This process will take about like 1 to 3 months to complete. And in the meantime, you can work as a co-assistant dentistry, it's called, a dentist, it's called. and that's a dentist without a big or the big registration. So in between, while you wait, you can still work. So basic information about starting in Netherlands is that you will have your own schedule with own patients. So you will get 12 to 15 checkups a day. And from these checkups, you can indicate your treatments yourself. So basically what you're doing is you plan your own schedule. You will get a single chamber. So that means you don't have to share with anyone else. It's just your chamber. And you get an assistant, which is quite some luxury because you don't have that in a lot of countries. So that is mandatory in the Netherlands to work with an assistant. You will work on a 40-hour per week contract most often, but that's also flexible. So if you want to work like 5 days, that's the contract you will get. But you can also say, I only want to work 4 days and get 1 day off. Like that's all very, like you're not bound to this 40-hour week contract. The most important, I guess, for the beginning is your salary. So your salary with this 40 hours a week contract will be 5,000 euros before tax. So in the Netherlands, this will equal around 3,500, 3,600 euros. It's also a very flexible contract. So if you're choosing to insure yourself and if you're choosing to do it all by yourself, this number can increase a lot. So that's also dependent on how much you work and a lot of insurance. But if you're further interested into this, you can obviously write me a message or contact the recruitment team of dental clinics. And you won't have Saturdays or emergency shifts. They're basically voluntarily. If you want to work extra, you can, but it's not mandatory. And we work from 8 to 5 o'clock every day. And then around the deadlines. So like, if you basically don't have deadlines, if you're interested in working in the Netherlands, you don't, like if you graduated, it doesn't matter if you wait 1 or 3 or 6 months. They are just willing to take you at any point, really. So with serious interest, you can just 1 year before graduating, you can make the first contact. That can be with me first, and then I will connect you to the recruitment team. And this recruitment team will guide you through all the steps. So you're basically not left by yourself. They will help you with every step you need to take to start as a dentist. There are, the possibilities to work in more practice, what I just said, we have more than 100 practices in the Netherlands. So you can choose work in 3 practices, for example, like I do. It's also dependent on how much demand there is and how many dentists there are working. And after you've done all these steps, it's just a motivational letter and a CV that are required. Then to the question, what are boosting tips? Like how can you make your application more attractive to dental clinics or to work as a dentist in the Netherlands? And it's basically, my advice is to learn the language. So you can start with some apps like Duolingo or Bubble or whatever they're called nowadays. Or you can start reading some newspapers in Dutch, just try to understand, see some words, and Dutch series on Netflix. So basically anything where you can hear the language will help you a lot. And internships beforehand at dental clinic practices are also quite handy. So if you just want to have an internship when you're in 3rd, 4th, or 5th year, then you can also like contact me or the recruitment team, and we can manage that you come here for 3-4 weeks, or the mandatory internships that are required from the university, and then we can just guide you through all the steps. And for the internships, it's mostly not necessary to speak Dutch. Because you're basically just you're guided by or supported by the dentist, and the dentists, most of them speak English, so it shouldn't be a problem. And what can also help you is just like the interest in the Netherlands itself as a country and the company, Top Monzo. So if you have some information about it and you read up on it, they're obviously more attracted to taking you in and making initial contact with dentists or the team where from the city you want to work. And obviously you can make contact with me and I can try to connect you to some other people, or you can do it via LinkedIn. But that's already a good start if you have some person to speak to at the clinic you want to work. So that's basically it from my presentation. And with serious inquiries, you can just mail to this email address that is shown there. and yeah, after that I can connect you further and provide you with more information. Yes.
Thank you so much, Doctor. Are there any questions for anyone who is particularly interested in working in the Netherlands at all? You can just unmute and ask yourself. But that was a very comprehensive presentation, so.
Hello, Doctor.
Hey.
Thank you so much for the PPT. It was amazing. I do have a question. How much does this internship approximately cost? For example, I'm a third-year dentistry student right now, and let's say if I want to do an internship in Netherlands for this summer, how much would you say approximately will that cost?
How much it would cost?
Yes.
It won't cost you anything.
Also, basically, it's going to be cost of living only.
Yeah, like your private costs. So like running with like just doing an internship with a dentist won't cost, like they won't charge you for it. They're just happy to let other people see the company and see the practices, and so you just have to see, maybe you know someone, or maybe you can just live in an Airbnb, and no, for the internship it's completely free.
Perfect. Thank you so much.
Yeah, you're welcome.
There's one other question, Doctor. Someone's asking, how long did it take you approximately to learn the language?
I'm German, and Dutch is very easy for Germans to learn. So like, without a joke, I learned it within 5 weeks. But I had this intensive private course with an amazing professor that did it, or amazing teacher. And obviously I have her contact as well. And if you want to follow the same course, you can just contact me and I will connect you with her. And that's based in Utrecht. So, and Utrecht is an amazing city. So you can just learn it there, and then like it's 4 to 5 weeks for me. And I think anyone can manage with a lot of discipline and with a lot of hard work. But if you learn Czech, then Dutch is actually no problem.
Thank you so much. Are there any other questions before we move on? So someone's asking, how is the application process different for non-EU nationals graduating from the Czech Republic?
It's pretty much the same. It's just that you get the visa. You have to manage to get the visa, but like that's also regulated via dental clinics. So if you get a working contract, they will help you to get a prolongation of the visa. Maybe you need some extra documents from the other countries, but it's almost the same.
And someone is asking, if we want to do our internship this year, will we get to work on patients or just observe?
Depending on which year you're in. So I don't know, fifth year. Yeah, it's really dependent also on the doctor, on the dentist. It's quite difficult if you don't really speak the language, because you obviously have to instruct the patient and speak to the patient and give them some explanation. But I remember my 5th year, I did around 10-15 fillings and some checkups, and you get to do a lot, like take x-ray pictures, and you can remove calculus, like all this beginner stuff, just to get into it.
Sure, thank you. And someone else is asking, since you're German, do you have any information about how we can pass an internship in German by any chance?
How you will get an internship in Germany, you mean?
Yes, that's what they're asking.
I can't give any information about that. I'm not living in Germany now for 8 years, and I would just recommend you to go to the Netherlands. That's my advice.
Okay, any other questions before we move on? So I think that is all. Thank you very, very much, Doctor. and we can move on, I think. So the next two.
Excuse me, may I ask a question?
Oh,
Yeah.
yes, sure.
I want to ask Doctor about how different is like the techniques and what we learn in Czech Republic compared to the way you are working in the Netherlands. And thank you very much.
Yeah, that's a good question. Like what you learn at university is the way you're supposed to do it. How you do it in a private practice with, yeah, you will have a lot of time pressure, and but basically it's the same. Like a filling is done in the whole wide world, it's done the same. It's just really dependent on the skills of the dentist, and the materials will be different, but that's also different from each country to each owner to each dentist. But you have quite a lot of flexibility. You can also just tell them, okay, I want to use this, I'm not happy with this, so I want to change the material, I've learned it like this, and then you will get some guidance. They will manage that you're content.
Someone else is asking, you said until we get the registration we can work as something else in clinics. Could you please repeat what that was?
Yeah, definitely. It's like, because you have to apply for this registration, but this registration, especially in Corona times, takes quite a long time because they have to double check everything and they're quite busy, and some are not working. So like you can estimate it can take 2 or 3 weeks, but it can also take 3 months. So but in between those 3 months you're basically just working as a normal dentist. To be honest, it doesn't make a difference if you get that registration or not. You're doing the same work. It's just that your title is different, and that what you're capable of doing is a bit different, because you're not allowed, for example, to write prescriptions because you're not registered yet for antibiotics or something like this. But for the rest, you can just work as a normal dentist. It's no different, and also the salary it's no difference, the same.
Someone's asking, how is it if we want to do a specialty in the Netherlands, regarding the application process and time, deadlines, tuition, or getting paid?
Speciality in dentistry, she means, I guess.
I believe so.
Yeah. Yeah. So before you, like, dentistry is different than general medicine. So I would advise you to work like for the first year as a general practitioner in dentistry. So like you do like your normal schedule. If you want to specialize right away, I wouldn't recommend that, because you have to learn all of the general dentistry first before you can specialize. But if you want to do that, there's lots of classes from the University of Amsterdam. I'm an Invisalign Go certified dentist now, so I did my class this year in Amsterdam, and next year I will follow some courses for aesthetics and facings and crown preparation all over the country. So that's basically how you can specialize. You can also follow a 3 to 4 year study at the Dutch University for actual specialization.
Thank you. They're also asking, are the programs in English?
Some of them are, but like by that time you should be able to speak Dutch anyways. Before you work as a dentist, you need to have your Dutch certificate anyways. So you should be able to speak Dutch. But it's a lot of English, of course.
Excellent. Okay, any last questions at all? Thank you very much, Doctor. So I think we'll be moving on to Dr. Harb now. If you could introduce yourself, if that's okay.
Yep. Hello, guys. My name is Masaryk Harb, and I'm a recent graduate of Charles University, Faculty of Medicine in Hradec Králové. And I currently am working in Prague as a general dentist. Thank you.
So this is going to be more like a Q&A. So I'm going to start off by asking, how do you find it working in the Czech Republic, having studied here and graduated and still working here?
Yeah, obviously, like, because you're kind of working in the same environment you studied in, so it's a bit easier that you're kind of whatever things you were doing practically in the hospital, you're kind of doing the same thing because everyone graduated from the same universities over here. They have the same way of thinking, same way of applying your practical skills. So it's kind of like a familiar environment for you. It's just a matter of speaking the language is a bit what most of international people struggle with at the beginning, the language barrier. But other than that, I think it's actually very nice working here. Yeah.
Nice. So, sorry, doctor. So, just a bit of background about you yourself. Like, so where did you initially, like, where are you from? And
yeah. So I'm from Lebanon, but I grew up in Abu Dhabi in the UAE, and I went to high school there, and I graduated, and I came straight to the Czech Republic for university.
The dentistry. Okay, and you know, I think a lot of the questions that would want to be asked are things like when you make that transition from being a student, a dental student in the Czech Republic, and working in the Czech Republic, things like, you know, the basic, how many hours are you expected to work? What does a typical working week look like for you?
Yeah, so initially, whenever you're kind of speaking with your future boss or whatever on the work, you can kind of set your working hours. They would give you like several options. I'm talking about private right now. Usually they'll give you like a schedule with several options of your working hours, and you can choose whatever you want according to whatever you prefer. So you could have like all morning hours or all afternoon, or you can have some hours in the morning, some hours in the afternoon. And usually it's almost, if you're working full-time job from Monday to Friday, it's around 40 hours a week. Obviously, you can ask to work overtime on the weekends, or you can have additional hours. It's up to you. But as a standard, it's 40 hours a week of working.
Thank you. And so, as you said, so this is to do with private dental practices. So are there two different options? Are there multiple options in the Czech Republic, or is it mainly private?
No. Like once you graduate, you've got the option of working either private or like in the hospitals, in the public sector. Obviously, you've got a few differences. People who want to work in hospitals tend to usually want to do like surgery, like some maxillofacial surgery or dental alveolar surgery. Obviously, you can still do like restorative dentistry, endodontics, and whatnot. But for that, I would recommend go private, because I think with private dentistry, you can kind of grow more in dentistry, because we all know dentistry is kind of evolving on a day-to-day basis. Every single day, you have some new techniques, some new equipment, and whatnot. So usually in private, you're more kind of like you see more of these stuff. You see more of these newer equipments, more of these newer technologies, and you have the opportunity to work with them rather than in hospitals, where they're usually sticking to basic stuff. So obviously, if you want to do surgery, then the hospitals where you would rather be working.
Sure. And I think another thing that people would want to know is, you know, the basic salary and what does the career progression look like for someone who wants to work in the Czech Republic?
Yeah. So if you're working in the hospital, I'm not too sure about that, but I think the starting salary would be between 20 to 30,000 crowns.
Sure.
Which isn't that much. When you're working with private, most of the clinics over here give you between 30 to 50,000 crowns as a fixed salary, and then they would give a bonus, which means that they would tell you, for example, if you would get 200 or 300,000 crowns as money into the clinic per month, if you reach that target, we would give you a 20 or 30% bonus on each patient that you worked on. So your salary might go from 40,000 to 80 or to 100,000 even crowns. Sure. And usually the 40,000 crowns is before tax. So tax over here is around 15 to 20%. So usually after the tax, it's going to be around 32,000 crowns as a fixed salary.
Sure. Yeah. Thank you. And another thing is, so what made you choose to want to work in the Czech Republic as opposed to somewhere else?
Well, just the fact that I've been living here for a while and I've already been familiar with the environment. And I personally would want to go back and work, because I've lived in the UAE all my life. So I would want to eventually go back and work there at some point. But for me, I was like that since I've been familiar with the environment and I know how the system works over here, and I started learning the language. So why not stay here for a couple of years, get some experience? Because wherever you go over here, even if you want to do some specialty anywhere in the world, they're always asking for at least 2 years of experience. You can't go to any specialty without having 2 years of experience. So that's why I decided to stay here for a couple of years, get some experience, and maybe do my specialty, and then I would think for the next step.
Nice. So in terms of the application process and the requirements, just after you graduate, or even while you were at dental school, were there any requirements that you had to fulfill aside from the standard exams?
Aside from the state exam, no. Like as in to graduate, no. But I think, well, I'm not sure about the other universities over here, but in Charles University, we usually have this kind of 1 month after the examination period, like in summer semester, so mid-February to mid-March, where they give us this 1 month of doing an internship. And this is one of the requirements as well. You have to have and to fulfill in order to graduate. And I would recommend to use this internship in a way to benefit you. So you could, for example, if you got some clinic in mind which you would want to work in the future at, or you were working at a clinic that you liked and you want to work there. So I would suggest use the opportunity to kind of show them that you're worth of working there, that you're interested in working there. And that would be also a good way of kind of securing a job before you graduate.
So sorry, just to confirm that. So aside from the actual state exams at your university, there's not like a formal requirement to do another exam or an entrance exam or anything like that?
No, you just got to do some kind of language exam.
Oh, okay.
Yeah, just that, but nothing like a state exam in Czech or whatnot. It's just like a language exam, just like a basic language exam which you need to do, and that's it. You can work.
So a proficiency language exam in Czech, and then other than that, okay.
Yeah.
So other than that, so it's the proficiency language exam, and then the normal standard state exams, and then that internship month. Excellent.
Yep. That's
and is there a deadline for all of these things?
No. There's no deadline. You can start working whenever you want, whenever you find a job. It's not a problem. It's just the matter of the visa. If you're a non-EU member, or if you're someone with a non-EU passport, then you're gonna have to secure a visa for yourself. So after graduating, they usually give you 60 days to kind of leave the country before they actually cancel your visa, even if it's gonna expire in a year or so. The moment you finish your state exam, they give you 60 days. So you can apply for a job-seeking visa. And that's like a 9-month visa, which you can have with you while you search for a job.
Sure.
Other than that, there is no deadline. But over here, there's a shortage of dentists as well, like a really, really big shortage of dentists. So it's not that hard to find a job in the Czech Republic, in my opinion.
And someone's asking, can you please explain how you progressed in Czech language and how you transfer? I'm assuming the language that you were taught in uni and the difference between that and the actual proficiency exam.
Honestly, we took 2 years of Czech in the first 2 years of our studies. It wasn't very productive because of all the other subjects we have, and it's not a priority at that time. But afterwards, when I decided to study in the Czech Republic, I got into contact with with a Czech teacher who was teaching me throughout the last year of my studies Czech. And because the exam is mainly focused on dentistry stuff, they don't they even say on the website that it's enough for us that you know only Czech related to dentistry. We don't need you to know day-to-day Czech or like social check. As long as you can know the dental terminology and read, for example, patients' cards and patients' anamnesis and whatnot, then that's enough for us.
Sure.
And if you guys need the contact information for the teacher who taught me Czech, then you can write me at the end of the chat or at the end of the lecture, or you can message me on Facebook, Instagram, and I could give you the contact information.
Thank you. And another thing is, is there an application at all, or is it just you basically apply to a specific dental practice with your grades from university? And if there is an application process, then what can students do in order to boost their application to look more, better?
No, it's just that whenever you find a job or you get in contact with the dental clinic and you go there, it's just the matter of showing them your degree, that you finished your degree, an authorized copy of your degree and your supplements, and that's all they need from you. Sure. Because they will be taking care of the rest. They will be making the insurance for you, because it's going to be taken out of your tax, so you don't need to pay for that. That's it. Usually, most of the clinics would ask for a CV prior to the interview. So I would recommend to have a nice CV done, put as many internships or practices, whatever you've done over the previous summers or back home. Just mention as much practice as you can, because they like that stuff. Sure. And it's always nice to go into the interview knowing a bit of Czech as well. Sure. They would like that, yeah.
Sure. Are there any other questions that anyone has? I'm just going to open the floor. So it says, were you able to work before passing the language exam?
Yes. Usually with private clinics, they don't really stress that much on the language exam. Like, they don't really need it as soon as possible. So they're a bit more flexible, a bit more lenient. So you could work for a couple of months before doing the exam. That way you can kind of actually practice your Czech in person and with the patients, and you can kind of improve your Czech as well. So you don't need to do it like ASAP, as soon as possible, before applying for the job. However, if you want to work in the public sector in the hospitals, they usually require it before you. It's like a condition for them that if you want to start working, you got to prove that you can speak at least B2 or C1 Czech, which is a quite high level of Czech.
Sure.
Yeah.
Thank you. And someone says, can you elaborate more about the job-seeking visa?
Regarding the job-seeking visa, it's like after you finish your studies, you can go and apply for one at the foreign police. It's just like a normal application, like the student visa. So you just need like the green paper, which you usually fill out, that 2,500 Czech crowns stamp, insurance, place of stay, like some kind of house contract or whatever for 9 months, and that's it. I think that's all you need. Again, I'm not too sure because I directly applied for my working visa. I didn't go through the job-seeking visa, but I think that's about it. But if you need any more information, I think you can check out the Ministry of Interior's website. It's all in English over there as well.
Sure, thank you. Are there any more questions? You guys can just unmute and ask if that's easier. So someone says, can you tell us about the possibility of going for a specialty here in Czech right after graduation? Yeah, so in the Czech Republic, they've got only 3 specialties, which is orthodontics, maxillofacial surgery, and the third one is like oral pathology or oral medicine. Usually, if you want to do anything else, it's like implantology, for example. It's just a matter of doing a course, like a 3 to 6 month course, and you can do your implantology. Like, for example, I would like to do implantology, and the doctor who I'm working for is an implantologist, and he's kind of teaching me as I go along. So that's all you need over here. Regarding prosthodontics or periodontology, there is no specific specialty over here per se. It's just these 3, like ortho, oral medicine, and maxillofacial. You need to go back to university for those,
to have like an official degree that you're specialized in those fields. But other than that, it's not. It's fine.
Sure, thank you. And someone says, also, would you please give us the website for the Czech language exam?
Yeah, for sure. Let me just search for it and I'll give it to you.
Sure. Are there any other questions in the meantime?
Was it easy for you to find a job? Like, how many applications you have to send?
Yeah, it was relatively easy. To be honest, one really thing that helped me was LinkedIn. That's an application, like a job seeking application. And a lot of the clinics are on that. So you could easily find a lot of clinics in the Czech Republic, especially in Prague. And you can just message them and they'll get right back to you. So as I said before, there is a shortage of dentists over here. So I applied to 5 or 6 clinics and I almost got quick responses from all of them. Yeah, and actually, like all of them actually offered me a job over here. So it is relatively easy.
Another person asks, can you please tell us where you started looking for a job? Is there a website, or should we contact dental clinics individually?
Yeah, as I said, LinkedIn, that's an application you can download on your phone. A lot of the clinics are there. You can just search on Google that there's a lot of websites on Google which kind of have like a job seeking websites for dentistry and dental clinics. Or if you have a particular dental clinic in mind, you can actually message them, email them. But the easiest way to do it is via LinkedIn, because most of the clinics are on LinkedIn who are offering jobs.
Thank you. And someone else asks, when did you start applying?
So I started right when I was doing the internship, so around February, March.
So this is after you'd completed your
Yeah. No, not after my exams. That was after my internship. So in February or March. Yeah.
Okay, sorry.
Yeah.
And it says, is it possible to specialize in Max Fax without the MUDR degree?
Yes. Right now it is. So over here, you can just graduate as a dentist and go straight into the hospital and start training for maxillofacial. So obviously they would first put you in the surgery department to have like easier cases with surgery. And as you progress, you can start to watch or assist maxillofacial surgeries. And then you can go into the program and start actually having your exams and all of that stuff. So you don't need to do the MUDR title first and then go into Max Fax.
Thank you. Any other questions from anyone? So if that's all, thank you very much, Doctor. I think we'll move on.
That's awesome. Thank you.
So the third dentist we have is Dr. Mahin, and he is from the UK. If you'd like to introduce yourself.
Hello, my name is Atta. I graduated from Palacky University in 2020. I started working in the January of 2021 here in the UK. I work currently in Brighton, and that's pretty much it. I applied from the UK, so I'm from the UK originally. I grew up here, so it makes coming back and working in the UK much easier also.
So if I could just ask you a couple of basic questions. So how do you find working in the UK?
I think working in the UK is good. I think the UK generally has a good working system, which supports people who have like high achievers who are aiming to move forward in their careers. And also it's a very stable environment where your job security is really high. I mean, dentistry job security is really high anywhere you are. But there is a pretty decent salary and a lot of opportunities. So I think generally working in the UK is great. Obviously the weather is rubbish. Obviously you have to deal with the UK stuff, but other than that, it's nice, especially when you're used to living for several years in Europe. Going back to the UK is a shift that you have to acclimatize to again.
So, sorry, just leading off that point, Doctor. So, how?
Miata, please.
So, how different was it from all the things that you've been practicing in Czech? Was it a vast change when you went to the UK, or and how long did it really take you to, you know?
I think, just as Chris said earlier, I think the way that we were taught in Czech Republic was really good, and it's the way it's meant to be. That is pretty much practicing by the book, doing every procedure with each step as we're taught and in our exams. Whereas working in a real life setting is so different because of the time constraints, because of the pressures and demands by the patients in order to see lots of patients as much as possible. Volume work is really important here, and expectation management, things that you're not really taught, you have to learn on the job. Whereas the actual procedures, I think it's so great that people are studying in the Czech Republic because it's taught really to the T. And that really gives you a really strong foundations of your theory in order to apply it in work. Whereas other places, I know graduates from the UK, it's almost the reverse. They're taught how to problem solve and deal with the patients more so than they are taught the straight theory. And when they're confronted with those situations where the theory helps explain a situation for a patient, for example, they might struggle or they might lack some confidence, where we're examined orally, so you're forced to be able to kind of explain yourself and be quite coherent in dealing with patients.
Thank you. So another thing is, obviously you have to, because you are from the UK yourself and studied here and went back, for those who are in the same position as you, what sort of requirements are there for you to fulfill?
So there are a lot of factors involved. I think one is if you're a European citizen or not, and if you're a British citizen or not. If you're not a European citizen, then I think there is a visa process that you have to go through, of course. If you're a European citizen or a British citizen, it's pretty straightforward. You need to register with the GDC first and foremost. That gives you a registration number in order to practice within the UK. The GDC itself has online in their website a list of documents that you need to gather and send to them, and then they go through your application, and they usually accept it pretty quickly. Within 6 weeks, within a couple of weeks, you get your GDC number. That GDC number is a registration number that allows you to practice at least within the private practice setting, minimum. Also, you can work as a hygienist, notably, with that GDC number. However, to be able to practice in the NHS, which is the National Healthcare Service in the UK, then you need to apply through the PCSE and get a temporary performer number. Now, all these words are quite complicated, but basically you need another application where they have to go through your medical history in your vaccinations to determine that you've been adequately vaccinated in the NHS guidelines for any practitioner. They go through your police checks from your Czech Republic and from here, and so on and so forth. I can actually show you guys my application. I need to share this, and essentially this is the biggest hurdle, which usually takes the longest, the application for the NHS service. Working privately, you don't need this performer number. But if you want to work in the NHS, which I really recommend, in that NHS dentistry is bread and butter here, that is the saying as it goes, and you see a high volume of patients, and there's a lot less pressure in that. The expectations of private patients here in the UK are far higher. They're paying so much more. So you get a nice introduction. Also, you get a temporary performer number, which at the beginning, in which at the end, you're meant to kind of bring together a portfolio of the the criteria that you were meant to meet, which is, for instance, you need to do 5 root canals and 10 fillings and a couple of extractions and so forth. And once you meet those, you and your educating supervisor, which is usually the practice owner of whichever clinic that you're working for, they clinically assess you, as well as you going into a meeting with some assessors in London or different places and so forth. And then it's relatively straightforward and it's not so difficult to get. I think the process is long and that sometimes can be a bit frustrating at the beginning, but that's a really important point about anyone coming to the UK. I think trying to sort that out as soon as possible gives you a sense of relief, because a lot of employers also ask for your performer number. They're looking for people to come and work for the NHS because they are so inundated with patients, and that's the kind of dentist that they're looking for at the beginning. As a graduate, you will be desired for helping with the NHS work, less so than the private work, because there are so many people as private dentists here in the UK.
And I just wanted to ask as well, so other than the application process and as you said, the volume of patients that you get, what other differences are there between working privately and within the NHS in the UK?
What are the differences between working privately and the NHS? You can more or less dictate how much you want to spend time with the patient, whereas at NHS, it's very one in, one out, back to back, non-stop. In general, that's how it feels to work in a normal day shift. But with the private patients, you have more time to talk and explain and so forth. You make the time to do that with your NHS patients as well, but then you are having to balance the pressures of the nurses behind you who are asking you to be a bit quicker and chat less because they need to clean up and get ready for the next patient. You're under pressure from the expectations of your boss and meeting your targets and so forth. So there's a lot involved, but there's a really important question I think asked by a bunch of people saying the DFT route or the PLV. The DFT route is very difficult. So many people I know across the years that have applied via the DFT and doing the SJT, situational judgment test exam and so forth, they did not get a place. That's not to say that people weren't deserving of a place or they didn't get a high grade. It's just that the UK students are prioritized in the DFTs. The UK students can only work for the NHS via the DFT route. That's why they're prioritized. Whereas EU national, EEA graduates can come in straight away and go for the temporary performer number application route, which is applying through the PLVE, and their website is called the PCSC something. Let me share my screen and maybe, how do I do this? Hold on. Entire screen. Share. Hold on. Okay. Can you see my screen?
Yes.
Okay. Hold on. For my passcode. This is the website PCSC Online. You have to go here. Oh wow, brilliant. Hold on. Oh, this is.
Could you please share the link on the chat?
Yes, absolutely.
Thanks.
Okay, so this is not working fine.
I think someone's asked, how do you find out which PLVE practice to work for?
Persistence and research and going through practices. So in a very personal like the personal situation for me, I came back and it was really hard to find a job, and it's very frustrating, especially reaching that September time where everyone's going back to university and you're thinking that you need to be doing something in that moment. A lot of people also like that time off period, and it's really good in order to kind of digest the last 5 years that you've been going through and take it a little bit easy. I personally, if I could have, I would have done what MIMSA did, and I would have stayed in the Czech Republic for an extra year or two. One, that makes your employability really high when going back to the UK. 2, it gives you really strong, I think you become a better dentist in the Czech Republic. I think the system in the Czech Republic, the discipline and the meticulousness of the standards that they expect, it's really high and it's really good. Here in the UK, it's so varied from practice to practice, to owner to owner. The kind of philosophy or ethics behind what the practice is looking to achieve, it's really based on a business model. That's the one thing about the UK dental system, which is so different to the medical system of working as a doctor in the UK. So that's why if you are not so desperate to come back and you're really stuck and you're wondering what to do, actually being brave enough to stay in the Czech Republic would be good for your long-term career. Whereas coming back to the UK, it will be riddled with a bit of stress in the first few months coming straight away, because I know I have graduate friends from my class who started a year later, or didn't start working until much, much later, or were not motivated enough to look because it's so hard. You have to be persistent. There is websites like Indeed.com where people are posting jobs. So this is Indeed, not Indeeding. So there are websites for employers to post availabilities. There's Facebook groups, which you shouldn't underestimate. There is a Facebook group called it's called the Dentist UK. Hold on. The Dentist UK. There are practice owners posting on there sometimes looking for associate dentists, looking for new graduates to employ. I think you also have to be careful to committing yourself to a corporate contract. Corporate contracts can sometimes be salary-based rather than self-employed based. A lot of UK dentists are self-employed. That means you're earning what you are performing. So the number of patients that you see and the types of procedures are priced differently, and from that you get a cut. So usually it's like a 40-60 cut or a 50-50 cut, which is favorable in terms of salary. Whereas if you get stuck on a salary, you can't really shift. Even if you're outperforming and you're working really, really a lot, doing hard things, you're not getting any more than that. And so that was a situation I was stuck between, because I got an offer to work in a practice in Cambridge back in October last year, but the dentist there was offering me a contract which was a fixed £22,000 for that year to be employed. Now, relatively speaking, I did the maths of the cost of rent and living and so forth, and actually it would not be sustainable to live on £22,000 sometimes, living in a different city, not living near home and so forth. So I had to say no, I had to turn it down, and that was a really hard decision to make. But being patient and being persistent with looking, you end up finding somewhere which does match your needs and matches the needs of the employer. So I think being patient and not so anxious and desperate will help you eventually find the right place. I think it's really easy to think, I just need to start and that's all that's important. And that was what my parents were saying as well, but you need to really know what you kind of want. Is it normal to find recruitment agencies with contracts of 3 years, or should I not opt for contracts like that? Yes, it's really common for groups to get you for a 3-year contract. Yes, I know 2 or 3 of my classmates that did that, and that's fine. That's really good. However, if you can find an alternative that is not a corporate contract, it's a much better position for you. You don't know what you're going to want or think after 1 or 2 years of working. So much changes. You end up possibly wanting to specialize or move from that city that you don't like. You could be stuck in the middle of nowhere. You could be in a really great place and you want to be there for a long time. It's so personally, for me, I think it's important to allow yourself to have as many options as possible, and binding yourself to a contract of 3 years is what it is. It's binding. And I think those contracts, for example, they they have certain clauses about if you wanted to leave early and so forth. And so the pressure of that is a lot, especially to go on top of the fact that it's the first time you're working, and that adjustment itself requires, you know, some flexibility for you, a recent graduate. But do opt if that's an option. Have options. That's really important. Get a number of options, number of ideas, and then picking between them is good. I think when you don't look for options and you're just being a bit lazy after graduating, which I was a little bit at the beginning, then you end up feeling the pressure of maybe I should just go for that corporate contract because that's the easiest option. But being persistent, waiting 2 or 3 months, maybe 4 months, and applying and sending your CV out to practice after practice, and checking Indeed.com every day and looking for opportunities that just pop up and then they disappear. Is there any way, is there any work we can do during the time we wait for GDC registration and getting the perform number? No, not if you don't have a GDC registration. Yes, if you have a GDC registration, you can work as a hygienist for a really good salary, making up on the up end of £30 an hour, whilst you're waiting for finding a practice to work as a dentist. So you can put your own application out on Indeed saying you're looking for hygienist roles, and there are people looking for hygienists and so forth. And I don't think that's a bad thing. I did that at the beginning. For a month, I was working as a hygienist, and then I continued working as a hygienist and working as a dentist. And it gives you a lot of confidence on just knowing how to work within your clinic and your space and interactions with patients and sitting at the by the patient, in like all of those theories and things that you've been taught. It's really nice to ease into it. Whereas dentistry at the beginning, it's intense. It's intense. The expectations are high, and yeah.
So
yes.
Hi, could I ask a question?
Please.
So I'm not sure if Palacky had the rule that you had to do professional practice, but did you do your professional practice in the Czech, or did you go back to the UK, or how did you go about that?
Is this in reference to
Like in our 5th year?
internships?
Yeah, internships. Yeah.
Honestly, a lot of the internships I didn't manage to do properly. I had a friend whose brother is a dentist or something, and I couldn't find, and they weren't letting me because of COVID, of the pandemic that we were going through. It was so hard to find somewhere that would just accept you to come and observe. So taking the opportunity to do it at the hospital clinics at university is fantastic. I have friends currently studying at Palacky who do extra hours with, you know, the personal relationships that you build with your professors are really priceless. They will let you come and sit and watch the procedures or help a nurse or something like that. You can go into the emergency wards, A&E, and just sit there and watch them do emergency root canals and so forth, and just see how that feels. That's good. Finding that in the UK, I think you'd find it a bit frustrating, because all it would be is observation, and it's so hard at the moment with the pandemic, really. A lot of practices, it's an easy excuse for practices to say no, and it's less headache for them and so forth. But if you can find one, yeah, why not?
Thank you.
Sorry.
Is there also anything that people can do to boost their CV and their application?
CV is really important. I think CV is really important. I think that's why uni is important, to do things other than just sit your exams and study. I think during that amount of free time that you have, putting on your CV what you're doing beyond dentistry is really key, to show that you are human and personable and interested in people and improving yourself. And yeah, working on your CV is good. Doing voluntary things is really important. I think, generally showing your competence in positions of responsibility, because that's what being a dentist is, a huge position of responsibility. It's not like being a doctor in a hospital where there are so many consultants that you have to go through before making a decision. Often you are the one in that spot, in that 2 minutes, that you need to decide what the treatment plan is, what your judgment of the diagnosis is, or if you don't know, to be able to be honest and to say that's out of your scope of practice, and not panicking when you don't know something as well. So all these things you need to be able to show on your CV, because often the interview that they have is 5 minutes long and they don't really get to know you as well as you can project yourself on a CV. And a CV doesn't mean making it fancy and bright and colorful and all of the show. I think it's actually the content of your character that you're trying to show.
Are there any other questions that anyone has for Atta at all?
Hi, yeah, I have one more question. When working privately, oh gosh, sorry, feedback. When working privately, do you still get the guidance or supervision you would with the DFT, or do you work independently from the get-go?
At the beginning, you get guidance. I think in the UK, so much is a 1 or 2 partnership, 1 person or 2 people partnership owning a practice, and they own the practice. Often they work at the practice, and let's say that it's a private practice, they will, out of purely caring about the fact that you're treating their patients, they will care about guiding you to a certain extent. But very quickly, after a month, I was expected to do everything alone. I think in the beginning, the practice owner was in the clinic most of the hours I was there. And so if I ever struggled on a root canal or diagnosis or even a crown prep, I would ask him to come and he would help, and he was very, very useful. Now, it's so individual. It depends on who the owner is, what they're like. You need to really sense someone's energy and the way that they, how they come across, how the owner, when you meet the owner of the practice that might employ you, it's also important for you to judge them on, do they seem like they care about developing you, or do they seem like they are just there to have you fill in the hours or the patients and so forth? Because it's really about you. You need to become really confident very quickly, and the way that you do that is with the guidance, but also being encouraged, being told that you're doing a good job, as well as being criticized. And so it's really individually based. It's so dependent on the practice owner. But more or less, yes, I think you get enough at the beginning. And I think your training into Czech Republic is so thorough that I know you don't get to possibly treat all the patients that you want to treat, but often I found in my classes, people were also not taking the opportunity to. There are root canals, patients coming in with root canals that they need, and people are too scared to do it. And you should not be, because once you're in the real world, you're liable for the work that you're doing. Whereas at university, it's their responsibility. And so you can perforate a canal at university and you won't be sued. But if you do that on your job and someone loses a tooth, that's the scarier thing. And on that point, I think, don't be too scared about when I got into the job first, there was a lot of talk, especially here in the UK, about malpractice, not malpractice, but being sued by patients. I think there's a huge fear by practice owners here about being sued. So don't fall for that. Don't become such a nervous practitioner. Don't be timid. But at the same time, like I said, be honest when you're working, what you can do and what you can't do, and patient expectations, and don't promise the world to a patient and then something goes wrong. And then of course I would be upset too if that would happen to me. So my advice, you have a couple months of clinics left, be the first one to get up and want to do a procedure. And that takes you a lot. it gives you confidence, and that's really what you need when you start work.
Right, thank you.
We have another question, and they are asking, in your CV, did you write it in detail about the clinical procedures you did and your clinical years?
No, not so much. Yes. No. I think as an employer, if I was an employer, I would expect, I wouldn't really think much of the 2 or 10 root canals that a student did at university. For me, it would not make, I would assume that they don't know very well how to do it properly yet. And I think employers are not stupid. They all were graduates at one point, and they know how clueless you feel as soon as you step into that environment. But really within a couple of months, the trajectory is really quick and high, and you get so much better at everything and confident. But the CV, a CV is like trying to piece the puzzles of you. They're not looking at it like, are you going to be a good dentist? They're really looking at the person that they're bringing into their business, the person that they're bringing into their baby that they're trying to raise off the ground. So it's not so much how many root canals and how many procedures that you did. It's more, what are you bringing to the table? Can you get along with everyone at the practice? How can you show that? What extracurricular things have you done? And that's really important. And it's not something you need to force, but don't be afraid to mention that you did dancing, or you did basketball, or you've been a part of a team, or you've been playing football, or you've been like going out of your way to do some voluntary work at university or beyond. Or those things are, I think, much more important. That's my personal opinion. I'm not the employer. I don't know. Maybe for some people it would be important, but more what you learned from your mistakes, or what you learned from the struggle of being going through all of those fillings, root canals, and bridges. How willing you are to learn more and not settle for, I did 15, 20 fillings, so I know that I'm pretty proficient at that. I don't think you should write something like that. How did you go about managing your UDAs? What if we do not meet our target? You don't need to worry about that. That's the practice owner's responsibility. You will want to do as much as you can once you're sitting there in that practice. At the beginning, in your first year, 2 years, like you're there to work. You're there to like feed like a sponge and use all the knowledge that you've learned in the last 5 years. It really like comes out. So I wouldn't worry about if you're meeting targets or not. You will like be working hard. Get ready for it. When did you apply for the GDC number, and what are the requirements to apply for it? The GDC number applied as soon as I finished my last exam. When you finish your last exam and you get your diploma, then you have to go to the university and get some other requirements, like something signed off by the dean, your health certificate checks, and There is a list on the GDC website of the requirements that they want. You send all of them at once, and they will they'll process it in about a couple of weeks, and you get your GDC number. You could technically get your GDC number by September. Some people already did. And that's the base standard. Like once you have that, then if you know someone, you can work as a private dentist immediately. But most of the applications on the Indeed.coms, on the Facebook groups, on these, like, there are lots of jobs going, but they're all for people with performer numbers. So really getting that training contract at the beginning is really important. And that's just getting your foot in. Now, that is often easiest done through the corporate way. The corporate way guarantees that they start it, and then but a few of us from my class, we waited, we found from our own research practices that were looking to employ fresh dentists, graduates, firstly as private, working a little bit, but also at the same time being our sponsors for our temporary performer number. They do that because they know that after doing that, they're going to get you as an NHS dentist, and you're going to be working for their NHS contracts whilst they get to do more private work. So everybody kind of wins in that sense. What are the working hours like during a PLV? Individual basis, working hours, you can work 8 to 5 days a week, which is usually a lot of work. You feel really drained after. But when you're self-employed, you get to choose your hours much more. And practices usually have more than one dentist, and there'll be a practice manager rearranging the timetables and shifting, and you can talk to them and say, I don't want to work on Saturdays or Fridays. Can I work 4 days a week? And often you can negotiate and do something like that, which is really nice. Now I work one day, Monday, Tuesday, Wednesday, 12 hours, so 8 to 8. And the next week I work Mondays to Fridays, 12 hours at the beginning on the first 3 days, and then just 4 hours and 6 hours on the other days. So I get to have 3 days off, 4 days off every 2 weeks, which is really nice. But that's from working at one place for a while, other dentists coming in and negotiating your timetables. What are we looking out for on the Indeed ads for jobs? You write dental, I think PLVE, or writing associate dentist. So the way I got my job is it was an associate dental role that was being advertised, and I emailed saying, I'm not an associate dentist. I've just graduated, but I'm looking for a practice that will take me on so I can get my performer number as soon as possible and work as an associate dentist as soon as possible. And they obviously looked at my CV and they thought, okay, why don't we just interview the person? And that's how it is. You just try your luck. You need to really push your luck, and I think eventually, if you're persistent, you'll get anything that you really want. Sorry for the questions. That's okay.
Are there any more questions for Atta at all? So if there aren't any questions, I'd just like to thank all three of our, someone's asking, could we take your contact details?
Yes, my email is this.
But yeah, so thank you very much to all three of our dentists for their time, and we hope that everyone has found this talk extremely useful. So yes, thank you, and also thank you to them for providing us with the contact details. So yeah, thank you very much. And I think, okay, yeah, we've got lots of thank yous.
I'm mad over here. Someone asked about the 9-month visa requirements. So this is the website for all the requirements needed for the job seeking visa. And this is the website for the Czech exam.
On that note, because I see your face, Mesa, again, it reminds me, as I was applying, a lot of the practices were saying, if only you had 1 or 2 years of experience after graduating, we would employ you. But because you're a fresh graduate, we just simply won't. That's why it's also such an attractive option to stay in the Czech Republic, get just 1 year under your belt.
Exactly.
And then
exactly.
1 year won't do so much, won't change so much, and you'll gain so much.
It's not just that. It's like I've been working for a few months, like 3-4 months, and I've already feel like I got a lot of experience just by working, because like you mentioned, when you're working like in your own clinic, like even though there's like other doctors over there, but you're in your own clinic with your own nurse, and you're kind of dictating everything that's going around. You're making the treatment plans, you're deciding, you're training your nurse on how you want her to work for you. You're getting all the instruments that you want to work with, which you're comfortable with. So all of that stuff is really, really useful. It gives you confidence, because that's a really important thing in dentistry. Confidence in making treatment plans, 100%.
Oh yeah, treatment plans took a while as well. I think people shouldn't be should understand that it takes a while. It takes several months to refine your treatment plans. It's so hard to do that off the bat, simply because we don't get that responsibility in Czech Republic. They already have the treatment plan there. We just have to do the procedure. Whereas
Exactly.
even 3 months into being a dentist and working, my treatment plans were still pretty crap to the standard that I consider it now. And then I'm sure in a year's time, I will think now I was not doing, and it just improves. So don't worry.
Yeah, at the beginning, you're always thinking by the book, like how they taught you in university, like, oh, 1, 2, 3, 4. But then, like, after working for a couple of weeks or months or years, you're going to start kind of thinking in a way which suits the patient in that specific case or in that specific time, because every patient is different. And every patient, you got to work according to their situation, their financial situation, their oral situation. So it's all different, not just like steps by the book, you know. So that's definitely, and as you mentioned, for everyone, if you have any opportunity at the university to do an endodontic treatment, a crown preparation, because you don't get many of those, anything, jump at the opportunity. Because I think I had 1 or 2 crown preparations in my whole uni studies. They don't let you do that. They just let you fix the crown, and that's it. But actually doing the preparation is not, it's not that common. So yeah.
No, crown prep is very, very difficult to do well. And that's something, if you can do well, you, 1, make a lot of money in dentistry, and 2, you get a better quality restoration in the end. And that's really so important. Also, with working, I think the difficulty of being in the Czech Republic also with the treatment plan stuff is you can't read the treatment plans really well. It's in a different language. Reading it in English, if you're going to the UK, just going through the other dentists' notes and reading their treatment plans, how they write, how they decision make, it's so good. It's better than revising. It's like, wow, it's so like neatly set up for you. You see the clinical complaint and the clinical history of the complaint and da-da-da-da-da. Whereas in Czech Republic, we can't really read that piece of paper so clearly. So you can't really form an idea of what a treatment plan even looks like. So use that opportunity. If you get internships in the UK or any English speaking practice, look at their notes, read the notes. It's really, really useful.
Yeah, I agree with you on that.
Much to our dentists once again. But yeah, thank you very much. And it's been very informative. Please leave us with your feedback, and we hope to see you guys for another career talk very soon.
Good luck, everyone.
Yeah, good luck, and thanks for having us.
Thank you.